Welcome, everyone. Thanks for coming out to learn more about Medicare and all the good stuff it has to offer. My name is, again, John Glowacky, and I'm with a program. It's on your handouts. It's called VICAP, which is the Virginia Insurance Counseling and Assistance Program. So it's easier to say VICAP. And basically what we are is we're counselors that are based here in the county. We're at 2100 Washington Boulevard, down closer to Fort Myer, that we basically for free help folks understand Medicare better. We'll go through some highlights of Medicare in 2016, and we'll also talk about our program. And one of the features of our program is that we also can meet with you directly and counsel you in terms of one-on-one in terms of your Medicare choices. For those of you that picked up the handout, our number is, there it is, it's 703-228-1725. So that's the main intake number. If you do want more information or would like to meet with us, you call that number, you leave your information, and we could make an appointment with you. They last about an hour, and they're very valuable. So it's, again, a free service. Actually, the funding for this comes through Medicare, so take advantage of that. Why not? We help all Medicare beneficiaries. We help folks that are new to Medicare or maybe becoming Medicare eligible. So consider that. We basically help you understand different plans available to you, all your benefits. We could help you with appeals. If there's an appeal issue you have with a claim, we can help with that. Okay? So again, we're at 2100 Washington Boulevard. We do also go to folks' homes. If you know someone or you can't get out or for some reason, we can go to your home and meet with you. We go to assisted living facilities if needed. A lot of our Medicare beneficiaries reside there. Senior centers, libraries like today. So Medicare, a lot of what we're going to talk about tonight is the Medicare.gov website. I think some folks were asking on the way in, what are my choices? This is a new, Medicare open enrollment is now. The go-to location for a lot of this information is the Medicare.gov, if you're not familiar with it. If you look to the left there, where it's the green button, it says Find Drug and Health Plans. What you can do generally is you'll click that button, enter your zip code, and then it'll give you a list of all the plans available to you in that area. So it's a very good starting point, okay? So we are in Medicare open enrollment right now, which is why we're doing these series of talks. We're doing lots of counseling sessions. We have volunteers that help us, but this is an important time of the year. Medicare open enrollment is October 15th through December 7th. So that's your period of time to look at your Medicare and make any changes if you want. Any changes you make during that period, January 1st would be the effective date of that change. So this is annual. The big component with Medicare open enrollment is Medicare Part D, which is the drug benefit. We'll talk about that and all the different choices you have. There are 25 Medicare Part D plans in the Arlington area. So if you may be in a plan right now and you seem like you're kind of happy with it, consider there's 24 others that may be better for you. And that Medicare.gov website that I talked about, would list all of those for you. The reason why it's an important period of time is that cost changes, they change annually. The amount of money you pay monthly for your plan may be going up next year. It can go down, it could stay the same. You kind of don't know. Your deductible can change. Again, up, down, stay the same. And the co-pays you're paying for your drugs can change. So all those things are a reason why to take advantage of this period of time. More importantly, the formulary list. This comes up a lot. Formulary is a fancy word for a list of covered drugs. That's all it is. So just because your plan changes, covers your drug for this year, you figure, well, I'm just going to keep it because everything's great. Next year, they could change the formulary, and they could say, well, your drug's not covered. And then you're going to come January 1st, you're going to go to the pharmacy and maybe not get any payment. So that's not what we don't want to see that. Again, use the Medicare Plan Finder, Medicare.gov. Again, you can go through our program. If you want more specific counseling, that's fine, whatever you're comfortable with. 1-800-MEDICARE will also do this for you over the phone. So consider that. And again, any changes that you make will be effective January 1st. Okay, so Medicare Part A, let's talk about the components of Medicare real quick. Medicare, this question came up before. Medicare Part A is your hospital insurance. So that happens anything that while you're inpatient, means that when you're admitted. Most people do get Medicare Part A premium free, as long as you paid your taxes along the way for 10 years or 40 quarters, so we'd look at them in quarters. You will not pay anything for Medicare Part A once you're Medicare eligible. Interestingly enough, for those that haven't paid their 40 quarters, the Medicare Part A premium is $407 a month. So something to think about how important that is for you. And there's also, for different categories, it could be up to $224, but most people really pay nothing for Part A. Okay. So Medicare also covers, Medicare Part A, in addition to hospital inpatient stay, will also cover a skilled nursing event following a hospitalization. That's considered a Medicare Part A benefit. Your costs are zero between days 1 and 20 and $157 per day from days 21 to 100, and then all cost. If you have a secondary insurance policy, most people do, your co-pays will be picked up by your secondary. So Medicare Part B, this quite frankly is the largest component of Medicare you're probably going to be using, because this is where all your outpatient activity happens. This is all your doctor's visits, your labs, your x-rays, all that good stuff. The standard premium for Medicare Part B is $104.90, so roughly $105 per month. There is a deductible of $147 per year. For 2016, these may go up a little bit, but let's hope. I mean, back in 1997, the Medicare Part B premium was $96.70, and now it's $104. So if you looked at that trend, I'm hoping it'll be relatively flat. They don't announce the 2016 numbers till about November, but usually it's a slow growth, which is good. There are different income requirements or different payment levels for those depending on your income. So to mention your Part B, base premium is $104.90. So what this very complicated slide is trying to tell us is if you are single, meaning filing your tax as a single person, just using that as an example, and making less than $85,000 per year, your Medicare Part B premium will be $104.90. Base rate, that's fine. However, it is income adjusted. So if you're making between $85 and $107, you add on a $42, what they call IRMA, income-related Medicare adjustment amount, and for your total of $146.90. So as you could see.
This year's rate or the one they're threatening for next year?
Well, for the one for, yeah, the question, and I'll repeat the question. The one for next year that they're talking about, and this is budget problem they're having in Capitol Hill, about this huge increase for Medicare Part B, adding another 50% premium on top of the $104.90. That basically, I could explain it this way, there's two competing laws, and those laws don't know what to do with each other. So it's threatening to sort of raise for people that are new to Medicare, brand new to Medicare, a higher Medicare Part B base rate. However, when I was sitting in the car on the way over, driving in the car, this whole budget discussion that just sort of is making its way through right now, 110-page thing, includes a fix for that. And hopefully we'll fix that. We'll see. So, yes?
Good.
Yeah?
That would fix the part that was going to like triple.
That would fix the, correct. It would fix the part that would fix the base, that would threaten to bump the base rate of $104.90 to like $150. But the cost sharing due to income would always apply. So
yeah, they were talking about tripling that, yes, because they couldn't charge
exactly.
The bottom.
Yeah, it was called a whole
tripling into
home.
the higher incomes.
Yeah.
Yes.
The new ones, it was $55.
Correct.
But for the higher incomes, it was those
Right.
incomes over 85,000.
Correct.
With bigger increments. That I did have a question
Sure.
related to
The IRMA.
income,
Uh-huh.
and I just want to confirm
Okay. I'll
that
repeat
if
that.
if you're collecting Social Security,
Okay.
that the Social Security amount
Mhm.
counts as income.
Correct. So if you're collecting
if you've got a $50,000 government retirement and you get $2,000 a month from Social Security, $24,000. Your Medicare would see your income as $74,000.
Correct. So what they do is whatever you claim on your tax return. If it's income that you're claiming on your gross adjusted on your tax return, how this file gets reconciled with Social Security is through the IRS. The only way Social Security would really know, other than self-reporting, but confirm what your income is through your IRS record. So they look at your tax return from 2 years ago. So we're 2015 now, they're going to look at your 2013 tax return. And if you do get applied this additional amount, they'll impose that for 1 year. And then next year, they're going to look at your tax return from the following year. It can go up and down. You can fall in and out of these adjustment amounts. So just be aware of that. In terms of if you're getting applied this fee and you shouldn't, you need to raise your hand to Medicare and say, take this away from me. But they look at your tax return. So whatever your gross adjusted is what they're going to look at. Okay?
The gross adjustment would only count as, say, 85% of 24,000 in my example.
Correct.
But the question I asked is, does Medicare count the 24,000 or say 20,000, which is 8%?
They would count if whatever your claim. I'm going to repeat myself. They're going to whatever you report is income out of that amount. If it's income that you're drawing from that account and you're putting it on your tax return, that's what they're going to look at. Okay. So Medicare Part B. Additionally, if this is sort of other numbers that I'm throwing at you here, but it will continue up. The good news, this is a continuation of the slide before. The good news with what I think they're fixed today, and they're hopefully going to fix, will continue to keep the premiums relatively low. Medicare Part D, it's a component that you have, an option that you have. This is your drug benefit. It's easy to remember, D drug. There is premiums associated with Medicare Part D. And the national average is, for the nation, is $33.13. Here, it's closer to $40, which would tend to be a little bit higher. But there are plans that start at $15. There's plans that go to $70. They all range within that 25 plan choice I talked about earlier. There are additional amounts based on your income for your Medicare Part D. Same categories, 85 and 107, all those categories. So they'll take your whatever base rate that you get, plus they'll add a percentage or a dollar amount based on your income. Okay, that's continued. So we were talking earlier with some folks about what happens if you don't take Medicare Part A and B when you need it. When you should, I shouldn't say need it, when you were first allowed to get it. Medicare Part A, generally speaking, is premium free. So when you turn 65, typically that's the way people get it. You just get a Medicare Part A card in the mail. You don't pay any premiums. You're happy. You go about your business. Medicare Part B, if you don't sign up for it, which is an option, since it has a premium, you don't have to pay the premium. But if you don't take it right when you should, and that, when I say should, meaning if you're not covered through another way, in other words, through another employer, or let's say you're still working and you're happy to work and you turn 65, you don't want this Part B, you can decline it, and you're getting your health insurance through your employer. When you finally want it, you can pick up the Medicare and say, phone and call Medicare and say, I want my Medicare Part B now. You will not get a penalty. If you are uninsured and are only basically leveraging Medicare Part B when you need it, they will impose a 10% penalty on your premium for every 12-month period you went without. So that's a way to motivate you to make sure. What they're trying to avoid is people delaying their Medicare Part B premium payment until they need it, because the whole thing would fall apart. So, okay. Medicare Part D, very similar. If you don't have another way to get prescription drug coverage, they will, a little different, they'll impose a 1% penalty for every 1 month period you went without. Sometimes that's not so threatening, so it's not so bad. Yep. This is a very, very complicated slide that basically talks about the donut hole. So part of healthcare reform was to sort of lower the effect of the donut hole, basically between about $300 or $3,500 worth of spending, total drug cost spending, to about $4,500. There is a sort of a gap in coverage for most folks. Right now, that gap, that $3,000 gap or so, half of the cost goes to you, half of the cost, because of healthcare reform, goes to the drug manufacturer, which is good. The purpose of the slide, it's very busy, is to really demonstrate the fact that hopefully by 2020, the donut hole will kind of largely go away, and it'll be more of an even payment. Okay. So preventative services, this is a relatively new thing. It's not so necessarily new for 2016, but it is a thing that Medicare is still shouting from the rooftops. Medicare does pay for preventative services. It's considered a Medicare Part B benefit. Generally, Medicare Part B benefits are covered at 80%. However, if it's preventative, it's covered at 100%. So when you go to your doctor and you say, I want XYZ exam, and it's considered preventative, if you're clear with them that this is considered a preventative service, they bill it that way, and then it's 100% reimbursed. So you're not having any co-payment. This is an example of what is covered on a preventative. There's a wellness visit, was basically a exam. There's a new welcome to Medicare, sort of new to Medicare visit, like I want to talk about my health, I want to talk about my health goals, all that good stuff. And a list of other things you could imagine. But smoking cessation, colonoscopy, mammography, all that, anything considered preventative is covered at 100% under Medicare. Okay, so they also, this is actually started in 2015, but they started covering lung cancer screenings, which is good. Other diagnoses, other motivators to sort of make sure. Smoking cessation should also be on here. That's a relatively new one, where if you feel like you want to quit smoking, they will pay for those services for free, no copay. Okay, so there are lots of other programs available for folks that may need help. I just threw a lot of numbers at you that some of them were a little costly, $104 a month. I mean, I've got clients that live on $500 a month. So there are services and there are assistance programs out there that may help you or subsidize that component. So basically, there are forms of Medicaid, which is state-based, that's state of Virginia-based. Here's some of the numbers for you. For example, to qualify for a type of program that would pay your Medicare Part B premium for you, if you're single, let's stick with that as an example, if you're making roughly less than $1,000 a month, you would likely qualify. Through our number, the number I gave you guys, the 228-1725, call our program, we can get this application. So they're all different programs. There are also programs to help folks that are on, for Medicare Part D, pay that drug prescription premium. The numbers are a little different there. If your gross monthly is less than $1,460, you'll likely get what they call low-income subsidy or extra help, in which you would have no premium payment or very low premium payment, and very low monthly co-payments, very, very low, like $1.50, $2.50. This is a big push right now for Medicare, Medicare's blue button, which is it's encouraging you to go to Medicare.gov. It's a way for you to more proactively track your activity, your claims data that's coming through, not waiting for like a quarterly statement to see what you did. So now, as of 2016, it does allow you to download 12 to 36 months of your claims data, and that's really important when you're maybe making health decisions or going to another location and you want to bring those with you. It'll also let you pull 12 months of prescription or Medicare Part D activity, which is nice. So it's good to have, yes.
Where is that?
It's Medicare, mymedicare.gov. If you can get to it through Medicare.gov, but it's best if you go to mymedicare.gov. You'll have to sign up to it. You registered it, yep. Like a bank account, think of it that way. Username, password, all that stuff you're used to. But it's a way, you'll get email alerts when you see claims come through. It's a much more proactive way. It really helps fight fraud too, quite frankly. Because a lot of people get their statements quarterly and they're like, oh, I got, the beginning of the quarter I had 15 things happen, they never really happened. It's kind of too late at that point, so, yeah. Yeah. Right, exactly. Right, yes.
Do you happen to know if you can sign up for that access and still retain your ability to get the paper copies in the mail?
Yes, you can.
Because like some banks and stuff,
Yeah.
if you access it online,
Right, yeah.
then they won't send you the paper.
Yeah, it's an either or. The question is, can I still get my paper stuff and go online? And you're right, with banks, it's usually either like a paperless choice, either or.
Right.
With this, you can actually get both, which is good. And it's good for record keeping. What's the advantage of this is that literally when the claim's processed, you get an email ding. You get an email sent, if you set it up that way, that said, this claim is processed today, and this is how much they paid, and this is who it went to. So it's much, from a fraud perspective, much better than waiting. So, yep. Okay. So again, fraud, good lead in. Remember, always protect yourself. Never. The big message of this slide is that Medicare and Social Security will never, ever call you. We got a lot of folks that tell us, I got a random call from Medicare and they wanted my Social Security number and this and that. And let's hope that they didn't give it to them, because Medicare will never, ever do that. Social Security will never, ever do that. So if you get a call like that, you're advised to just hang up. If you're more proactive, you may want to get their number and call the police. But don't take the bait is the point, because again, they will never ever contact you. The only time that they will is if you call them and he says, well, if you leave your name and number, we'll call you back in this time, in this hour window. My suggestion when that happens is say, if they do call you back, say, okay, now can I get a number to call you back? That way you're controlling it. You're not, it still could be fraud. It likely isn't, because you've arranged for that. But at least, can I have your name, can I have your direct number so I can call you directly? That way you're in control. So, okay. So that's us.